Today, we will discuss asymptomatic hypertension. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Asymptomatic hypertension, in simple terms, means having high blood pressure without showing any obvious symptoms. Many people with this condition might feel perfectly fine and not realize there's a problem. How to know if you have asymptomatic hypertension? 1. Regular checkups. The most reliable way to know is by having your blood pressure checked regularly by a doctor or using a home blood pressure monitor. 2. Know the numbers. Normal blood pressure is usually around 120/80 millimeter Hg. If your readings are consistently 130/80 millimeter Hg or higher, you might have hypertension. 3. Risk factors. Be aware of factors that can increase your risk, such as being overweight, having a family history of high blood pressure, smoking, and not exercising. 4. Lifestyle changes. If you're at risk, consider lifestyle changes like a healthier diet, regular exercise, and reducing stress, even if you don't have symptoms. It's important to consult a healthcare professional if you suspect you might have high blood pressure, even if you feel fine. If someone has asymptomatic hypertension, high blood pressure, here are some simple steps to follow. 1. See a doctor. Schedule a visit to discuss your blood pressure and get advice on treatment. 2. Monitor blood pressure. Keep track of your blood pressure regularly, either at home or through doctor visits. 3. Eat healthy. Focus on a balanced diet with lots of fruits, vegetables, whole grains, and lean proteins. Reduce salt intake. 4. Exercise regularly. Aim for at least 30 minutes of physical activity most days of the week. 5. Maintain a healthy weight. If overweight, losing even a small amount of weight can help lower blood pressure. 6. Limit alcohol. Drink alcohol in moderation, if at all. 7. Quit smoking. If you smoke, seek help to quit, as smoking can raise blood pressure. 8. Manage stress. Practice relaxation techniques like deep breathing, yoga, or meditation. 9. Follow treatment. If prescribed medication, take it as directed by your doctor. By taking these steps, you can help manage high blood pressure effectively. In a hospital, if someone is admitted with high blood pressure, hypertension, here's what typically happens to help them. 1. Check vital signs. Nurses will measure blood pressure, heart rate, and other vital signs to assess the situation. 2. Medical history. Doctors will ask about symptoms, medical history, and any medications the person is taking. 3. Blood tests. They may take blood samples to check for other health issues related to high blood pressure. 4. Monitor closely. The patient will be monitored continuously to watch for any changes in their condition. 5. Medication. Doctors may give medications to lower blood pressure. This could be done through an IV or oral pills, depending on the situation. 6. For fluids. If necessary, they might provide fluids through an IV to help stabilize the patient's condition. 7. Lifestyle guidance. Once stable, doctors will discuss lifestyle changes and possibly prescribe long-term medications to manage blood pressure. 8. Follow-up care. They will arrange for follow-up appointments to ensure the patient continues to manage their blood pressure effectively. These steps help stabilize the patient and prevent further complications related to high blood pressure. Here are some commonly used medications for managing high blood pressure, hypertension. 1. Diuretics water pills, hydrochlorothiazide, furosemide Lasix, 2 ACE inhibitors, lisinopril. 3. Angiotensin II receptor blockers, losartan, valsartan. 4. Calcium channel blockers, amlodipine, diltiazem. 5. Beta blockers, metoprolol. Renin inhibitors, aliskiren. People who may be at an increased risk of developing high blood pressure often include 1. Older adults. As people age, their blood vessels can become stiffer, leading to higher blood pressure. 2. Overweight individuals. Carrying extra weight can put more strain on the heart and raise blood pressure. 3. Sedentary lifestyle. Not getting enough physical activity can contribute to weight gain and higher blood pressure. 4. Unhealthy diet. Eating a lot of salt, processed foods, and not enough fruits and vegetables can increase the risk. Family history. If close family members have high blood pressure, you might be more likely to develop it too. 6. Stress. Chronic stress can lead to unhealthy habits and can also raise blood pressure. 7. Smoking. Tobacco use can damage blood vessels and raise blood pressure. 8. Excessive alcohol. Drinking too much alcohol can contribute to high blood pressure. 9. Certain health conditions. Conditions like diabetes, kidney disease, or sleep apnea can increase the risk. Being aware of these factors can help people take steps to lower their risk of developing high blood pressure. Now you need to watch my video on strokes or have a look at seizures.